because I think because I believe that we need to definitely showcase our talents to make everyone aware of what exactly we do. So maybe all these state restrictions can be uplifted and that we can actually go to our autonomous role that we know that we can do. So without further ado, oh, I'm sorry. And the last thing I wanted to talk about as well was we also going to have a special guest on October 9th for breast cancer awareness. So please log on, please be heard, please, bring pencil and paper if you want to jot down any information. It should be really good. And then for tonight as well, if you want to have something like pen and paper to write down anything that's informative that you want to share with your family or with your friends, please do so. We want everyone to be aware, okay? And I am also going to put the website for GAMPA in the chat. So just be aware of that I'm going to do that if you want to know more about the organization. We accept donations. We love people to chat and give us more information about whatever specialty they're working, or just to, communicate, log in, raise awareness and pictures. We do it all. We take it all. So we appreciate all the things that you guys do for this organization. So without further ado, I would like to introduce our speaker tonight, which is Gracious Montgomery. She was so willing to do this. I cannot be more excited for Ms. Brown. So I'm gonna do a few things about her. She is an APP lead at Emory University School of Medicine. She's working at the Department of Urology at Grady. Certified by the National Commission of Certification for Physician Assistants, urology trained for 7 years. She's Georgia certified in cystoscopy procedure and complex catheter placement. She's the current lead APP at the Urology Clinic in Grady. I already said that. Co-author of the Overactive Bladder article publication in 2019 Journal of Urology. She's an active member of the American Urology Association. She is a preceptor for Emory PA and for the medical students there. And she also helps aspiring PAs and other healthcare professionals. She also mentors the students. So without further ado, I would like to introduce you all to Miss Gracious Brown, PAC.
Hello, everyone. Hello. Thank you all for being here virtually, taking out the time to learn a little bit about prostate cancer. I'm very excited about this talk today, and I will leave my contact information and details at the end for people who need just a little bit more out of this than the conversation itself. There will be details on how to get in touch with me via email. Even if you want your own private consultation for yourself or a loved one. So without further ado, let's get into it. Let's talk about prostate cancer. I'm sporting my blue today in the support of this very special month. Just as a house rule here, I have no conflicts of interest. There's no financial gain from today's presentation, either with GAMPA or the Prostate Cancer Foundation or the American Urology Association. All info disclosed here is for the benefit and knowledge of you all that are attending today. So what is urology? I get this question a lot. Urology, we are a surgical subspecialty that focuses on the urinary tract in both men and women, as well as the male reproductive system. Just a nice, cute little agenda for today. We're going to discuss general facts about the prostate itself, including the anatomy, some cancer facts, risk factors, screening protocols, some symptom presentation, prognosis, treatment, and some life after treatment facts. So here's a visualization of the male anatomy. What you see here is the bladder photoed, the prostate gland itself, as well as the penis, the scrotum, colon, and rectum. Just another housekeeping rule during today's presentation, I will use a lot of verbiage that many people may find a little unorthodox, but this is the human body. This is the male anatomy. And so I hope we can take our feelings out of whatever uncomfortableness may come from some of the anatomical terms used. Just remember that this is a teaching point for you all tonight, okay? All right. So here's some facts regarding prostate cancer in general. 1 in 8 men at some point will be diagnosed with the disease in their lifetime. It is the second leading cause of cancer-related deaths in American men. To that point, 1 in 6 Black men will be diagnosed with the disease, and 50% of men infected and diagnosed, Black men that is, with the disease, unfortunately have a lower life expectancy as it is related to the disease itself. As you can see here, Black men are 75% more likely to develop the disease, and again, 50% more likely to actually die from the disease. Men with a positive family history and first-degree relatives like brother, father, uncle, those men are particularly higher risk of developing the disease. And just another fact, prostate cancer is an androgen-fed malignancy, which means that it thrives off of the male sex hormone, testosterone, and some of testosterone's byproducts. It is very treatable and has a very high survivability rate, but one cannot be treated if one is not screened appropriately. Which leads us into the screening tools. So screening for prostate cancer is very simple. Radiation is just a touch different from surgery, but even men who had radiated pelvises suffer with urinary frequency and urgency just from the friability of the technique itself. But again, as long as the patient has an open mind, there are always things that can be entertained or presented with the proper guidance and recommendations, of course. Now, bowel health is not really an issue that we see on the surgical side of things, but having radiation, I've been told, can lead to having some bowel discrepancies and issues for men down the line who choose radiation, again, for their primary treatment options. But before all else, just the emotional health of being treated before, during, and even after, the patient's preferred method of intervention. Being diagnosed with cancer is not an easy diagnosis to carry, whether it's a low-risk disease or a metastatic disease. The C word is a word that most people do not take lightly, nor should they. And that can be really detrimental for patients. So it's really important to use good discretion in how you approach these conversations, because in a lot of instances, sending patients to surgical specialists, they tend to have a lot tougher exterior than in many cases we should. And we need to utilize a little more emotional compassion with these new patient diagnoses. Here's a nice little guide that we refer to as the Prostate 8. This is just a great, easy tool to utilize to improve a man's prostate health over time and to, of course, reduce risk of a man dying from prostate cancer who's been diagnosed, of course. So in summary, prostate cancer screening is essential. You can't be treated for a disease that you're not being screened for. And all men are susceptible to the disease. All men are at risk, but it's really important to know about your family history and then to also have these conversations with your healthcare provider. As healthcare professionals, it's difficult to stay on top of all issues, which is why I make it a point to educate my patients that yes, you do rely on your primary care provider, but it's more important for you to initiate a lot of these conversations as well. You all would be extraordinarily surprised that even in an academic setting, how little prostate cancer is being screened, which is unfortunate because this is a very real part of any man's lifespan if they live to see a significant age in life. And with the proper screening, we can really reduce the risk of seeing advanced metastatic disease that can really bear weight on a patient's quality of life. And even when you feel fine, it's important to be screened because maintaining a quality of life, while it may not be everyone's primary goal, it's certainly something that I try to drive when I just have these discussions with my patients. And while many of the treatment options do have undesirable side effects, again, it's really important to know that these are a lot and oftentimes things that can be treated with the right type of mindset. And as a community in whole, it's really important to work towards reducing any stigma associated with the male reproductive system and specifically prostate health. It's not always an easy conversation, but it's certainly one that should be had. All righty. I am more than happy to take any questions for people who...
Presentation was very...
Uh-oh, I don't know if it's me. Are you there, Monique?
I'm still here. Can you hear me?
Okay, I can hear you now.
Oh, okay. I was saying that I know it was a very important topic. And I know that may have some questions. I just wanted to clarify as well too, that regardless that there are treatment options for males in regards to prostate cancer and for a to also have a sexual lifestyle, because that's the question that I get from patients on my end is, once I get treated, is that it for me? You know what I mean? Sexually. And for, you know, that's important in certain patient's life. And I want to make sure I give them the correct information as far as what to expect or not to expect, because again, there is a stigma about it. And I don't want people to be like, no, I'm not getting nothing done because I can't go without my, my sexual health work. And that's something that is very, very prevalent. And I just want to make sure that the communication that I give is the correct communication I give to the patients.
Absolutely, Monique. That's a really great point that you bring up. And it is certainly on the forefront of really most of my patients who I see. They are concerned about what their sexual health will look like post-treatment. And to answer your question, yes, there's always something that can be done, whether that be medications by mouth in the form of like the Viagras, the Levitras, the Cialis. In a lot of instances, those things typically don't work after radiation and surgery, but it's not to say that they won't ever work. That's just been my experience over the last 7 years. But there's injectable agents that can be entertained. You have to have an open mind to utilizing these things, but it is very much so possible. And for patients who just don't want to do injections or are not interested in that, we can even offer further surgery for like an implantable device in many cases. So sexual health does not, having an intimate life does not have to be off the table after you've been treated for your prostate cancer.
Gotcha.
That's a good question.
Does anyone else have any questions or comments? Anything of concern? And you can unmute yourselves if you have any questions.
And for people who may be shy, feel free to just, snap my QR code here. You feel free to send me an email if you're interested in having your own private consultation as well.
Everyone is saying great presentation and thank you. It was a great presentation. Thank you so much. Everybody, please give this information to your family, to anyone that may have questions or stigmas about it, that we really need to get informed and get the word out about prostate cancer for our men.
I have one question.
Oh, go ahead.
Yes.
How painful is the biopsy?
So that's a good question. I tell all my patients, pain is subjective. So what hurts one person may not hurt another. But to that point, there's a lot of different forms of anesthetic that can be utilized. We most often use a local anesthetic to the area, but for patients who can't conceptually wrap their minds around doing that kind of procedure awake, it can also be offered in any ambulatory surgery center or even in a main operating room if necessary as well. So again, to answer your question directly, pain is always subjective and it's depending on the person. But if you know at baseline you have a very low pain threshold, it would be a good idea to have that discussion with your urologist so they can at least offer it to you in an ambulatory surgery center.
Okay.
But yeah, like after the procedure, pain is minimal.
Does the procedure cause a disruption would cause a disruption in my sexual life? So
the biopsy itself, from a physical standpoint, should not impact your sexual capabilities. Now, it may lead to some emotional distress because there can be some side effects that come with the biopsy. The most common thing that men find to be the most disruptive or unsettling is seeing blood in the ejaculate. And from a mental standpoint, that can really bear weight on a man's performance if they are already at baseline, pretty self-conscious about knowing that they're going to have that issue.
Okay.
But from a physical standpoint, no, it does not impact your ability to perform.
Okay. That's all I had.
Good question. Thank you.
Does anyone else have any questions? Well, make sure you scan the QR code if you have any questions. And Migracious, thank you again for basically sharing your knowledge with us and informing us so we can inform others. So we really appreciate that.
Well, I appreciate the opportunity to share this information because prostate cancer in September doesn't always get the love it deserves. And this is a disease that heavily impacts my direct community. So I'm hopeful that us having more conversations will destigmatize some of the misconceived, conceptions about this disease process and the male reproductive system in general. And I hope that it causes more men to have these discussions with their healthcare providers.
I agree. Thank you so much.
Of course.
Everyone, please remember October 9th will be our next meeting. Same time, 7 o'clock, same meeting ID code. That doesn't change, but we'll be talking about breast cancer because it'll be Breast Cancer Awareness Month as well. So looking forward to seeing all of you. Thank you guys so much. And if you have any questions, reach out to Migracious or myself by the QR code, and I'll also put the website in the chat. So if there's any questions, please feel free to reach out to us, okay? Thank you for joining us.
Yes, thank you all. Have a good evening.